of this session, the learner should be able to define axilla, describe boundaries of axilla, describe the contents of axilla, and correlate some applied aspects such as brachial plexus block and long thoracic nerve injury. Axilla or armpit. It is a pyramidal anatomical space placed obliquely between upper part of arm and chest wall. It has got an apex which projects towards root of the neck and a base and four walls. Notable aspect is that soft skin covering lateral wall contains many hair and sweat glands which produce body odor. It is an important region both in terms of neurovascular structures and clinical relevance. Slide shows very good exposed axilla in a dissected body. Boundaries of axilla. Apex or cervicoaxillary canal. It is a triangular passageway between neck and axilla. It is bounded anteriorly by clavicle, posteriorly by superior border of scapula and coracoid process, medially by outer border of first rib. It contains neurovascular bundle for upper limb and long thoracic nerve. Base of the axilla is convex upward in the shape of a dome. It is formed by skin, superficial fascia, and axillary fascia, and is bounded anteriorly and posteriorly by axillary folds between humerus and chest wall. The dome is maintained by suspensory ligament of axilla. Walls of axilla. Anterior wall. It is made of pectoralis major and minor with clavipectoral fascia. Posterior wall made up of teres major and latissimus dorsi muscle. Medial wall is made up of upper four ribs and three intercostal muscles overlaid by thoracolumbar fascia and serratus anterior. Lateral wall is formed by bicipital groove with long head of biceps and coracobrachialis. Contents of axilla. Diagram shows transverse section of axilla with its contents, which are number 1, axillary artery and its branches, number 2, axillary vein and its tributaries, number 3, infraclavicular part of brachial plexus, and long thoracic and intercostobrachial nerves. Number 4, lymph nodes and lymphatics. Number 5, fat and areolar tissue. Axillary artery is continuation of subclavian artery at outer border of first rib. It continues as brachial artery at lower border of teres major. Artery is divided by pectoralis minor into three parts. First, proximal have one branch. Second, deep or behind pectoralis minor has got two branches. Third part is distal part which has got three branches. As regard relations, axillary vein is on medial aspect of the artery throughout its course. Cords of the brachial plexus lie posterolateral to first part. Respective cords encircle second part, and third part is surrounded by branches of the respective cords. Axillary artery branches. First part gives superior thoracic artery, second part gives lateral thoracic artery and thoracoacromial artery, which have got four sub-branches: acromial branch, deltoid branch, pectoral branch, and clavicular branch. Third part gives anterior circumflex humeral artery, posterior circumflex humeral artery, and subscapular artery. Axillary vein is continuation of basilic vein at lower border of teres major. It ascends medial to axillary artery and continues as subclavian vein at outer border of first rib. Its tributaries correspond to the branches of axillary artery. It, in addition, it receives cephalic vein. Notable point is that vein has got no axillary sheath, hence it is free to expand during times of increased blood flow. Brachial plexus formation. It is formed by anterior primary rami which are named as roots. These rami join to form upper, middle, and lower trunks. Each trunk divides into ventral and dorsal divisions. Then divisions reunite to form lateral, medial, and posterior cords which give following branches. Lateral cord gives 2 branches, medial cord gives 5 branches, and posterior cord also gives 5 branches. In addition to cords and their branches, axilla has 2 nerves. Number 1 is long thoracic nerve which descends along medial surface superficial to serratus anterior, hence is vulnerable to injury during radical mastectomy. Second nerve is intercostobrachial nerve, which is lateral cutaneous branch of second intercostal nerve and innervates upper medial part of arm and adjoining area of the chest. Axillary lymph nodes. There are 20 to 30 nodes which are dispersed in axilla with reference to its boundaries in 5 sets. Number 1. Anterior or external mammary group. These nodes lie along lateral thoracic vessels. Number 2. Lateral or axillary group. These nodes lie along axillary vein. Number 3. Posterior or subscapular group. These nodes lie along subscapular vessels. Number 4. Central group. Lie in center of axilla, receives lymph from anterior, posterior, and lateral groups, and itself drains into apical group. Number 5. Apical or subclavicular group. Lie along axillary vein at lateral border of first rib behind clavipectoral fascia, receives all above groups and drains into subclavian veins. Empty into root of neck, left into thoracic duct, and right into right lymphatic duct. Slide anatomy. Long thoracic nerve, also named as nerve of Bell or nerve to serratus anterior. Injury to this nerve is caused by sudden pressure on shoulder from above, carrying heavy load on shoulder, or injury during radical mastectomy. This produces deformity named as winging of scapula with prominent medial border of scapula. This produces disability with loss of pushing and punching actions. If attempted, makes more prominent medial border of scapula. One point to be noted is that overhead abduction of shoulder girdle is partly affected. This is because of intact trapezius muscle. Brachial plexus nerve block. It is a regional anesthesia technique. There are four types: interscalene, supraclavicular, infraclavicular, and axillary plexus block. Procedure is preferably ultrasound guided. Position of the sheath is identified by feeling pulsation of third part of axillary artery. Distal part of the sheath is compressed and anesthetic solution is injected into the proximal part of the sheath, producing axillary plexus block. Thank you for listening and watching.